Well, as part of Ask the Man Who Owns One, I have brought along a good friend of mine, a gentleman named Edward McNeil. It's funny that the two of us that came from New York are both named Edward, and I thought of it, there's something in that. You know, St. Edward was the King of England, and the King of England still carries a title which he earned. And the title that the king has, that was given to St. Edward by a pope long since gone, was, or I should say is, Defender of the Faith. Well, maybe the two defenders have come up. Maybe St. Edward's given us a boot in the tail. Get up to Boston, boys. Go on. Edward McNeil is a living example of the man who owned one. He practiced medicine and tried to practice medicine in England. He's the past president of the British Commonwealth Medical Society in New York, composed of doctors, English origin or Commonwealth origin, who have voted with their feet. In England, he was a hospital doctor. He was a general practitioner. He was a clinical assistant in the outpatient department of the Royal Throat, Nose, and Ear Hospital. I asked him if he only treated queenly or kingly throats, but he said no, that's the name. Royal Throat, Nose, and Ear Hospital in London. And I would like to introduce Dr. Edward McNeil, the man who owned one, put it down, and walked away from it.
Thank you. It's very nice to be here. I do not have a license to practice in Massachusetts. I believe that's where we are. I do have one to practice in New York, but with your permission, I would like to practice a little medicine. Ask you all to take 2 big, deep breaths. Can you? That's great. Another one. Very good. Now stand up for 2 seconds. Move your legs, butts. We may have prevented some pulmonary emboli or a few other things. We've heard a lot about socialized medicine, and it's almost become a reality here. At the beginning, when it was a new subject, they used to point at the British National Health Service and say how wonderful it is. But of recent times, I haven't heard too many comparisons with it, and there may be some reason for that. As being a victim of practicing under this situation, I'd like to give you a little bit of nitty-gritty that you could possibly use in your debate with other people. That'll give you some idea of why our present system, or what our system was here, is better than the socialized form. I think it's valid to look at the British system from 2 points of view. There was some justification for it in England in 1948. The socialists took over power in 1945, and the situation that they had was the sad fact that maybe 80% of the population were what we would consider underprivileged. They had been getting some sort of medical care on a panel system. A lot of people didn't get any medical care. Preventive care was almost non-existent. And we'd learned so much about medicine during the war, and from our contact with American medicine, through your services being over in our island, that there really was some need for certain social reforms. And it's rather strange that it was a conservative gentleman who first drew up the form of the National Health Service, Sir Henry Willink. And I have to admit that as a 17-year-old, when he first started writing about this, and this was possibly in 1942, I thought it was a good idea, because the situation in England was such that there was a need for it. Now, is there a need for socialized medical care in this country at the moment? I do not think so. We certainly do have underprivileged in certain areas, in certain ghettos. These can be taken care of through certain socialized schemes at a very local level, preferably through some sort of philanthropic mode. And somehow charity and philanthropy have sort of become dirty words recently. But this is the way to do it. I think the majority of people in this country can very well provide for themselves that sort of care which they require. Okay, to provide something, you've got to pay for it. Let's see how much they pay in England. A doctor not too long ago coined the phrase FAT, F-A-T-T, which means free at the time, because it appears free. But what do you pay for it? I called up the British consulate yesterday to get what I hoped would be the latest figures, and they hadn't quite counted all the band-aids for 1969, so I got it for 1968. They gave me these figures. The total cost of the National Health Service, hospitals, doctors, everything, was 1,559.4 million pounds. We'll change it to dollars later. The total national expenditure was 11525.1 million pounds. This means that 14% of all government expenditure went into health services. I think that's a pretty sick nation that needs to spend 14% of their income on health services. Certainly we should spend a lot, but look at it from the individual's point of view. There's a population of 55 million, was the estimate for 1968. That puts it, dividing the population and the total cost of the health service, at £210 a year per head of the population. This is $525. That's a lot of money. You can say, look what sort of insurance you could buy here, Blue Cross, Blue Shield, Major Medical, and what it could get you for $525. But don't forget, this is per head, man, woman, and children. So if you've got a family of 4, think what coverage you can get here. The cost in England for a family of 4 is over $2,000. This is an awful lot of money to pay for health care. How is it extracted from the patients? Apart from the huge contributions that are deducted from the salary, everything they buy has a tax on. And it would rather frighten you. I'm not advocating buying cigarettes, but in England they still buy them, and they cost 70 cents a pack of smaller cigarettes. Gasoline costs $1 a gallon. Admitted the gallon is just a little bit bigger, but not that much. And everything you buy, when you buy a car, it's 25%. It was 33 1/3% tax. So everything has got a tax on. As I say, nothing is free, it has to be paid for. And the man isn't left with that much. Now, when you consider a family of 4 and that their expenditure per their heads is $2,000, think what the worker there gets, not to what our income is. The average worker makes £20 a week, which adds up to about $2,500 a year. So in actual fact, he's spending all his income, or the equivalent of the whole of his income, for the 4 members of his family, if he has 4. So much for cost. Why does it cost so much? because with government-controlled medicine, you're not paying for one thing, the care of the sick. You're paying for three things. You're paying for the care of the sick who need it and preventative medicine. You're paying for the cost of running the bureaucracy. And I could give you many stories of how this multiplies within a small hospital. I maybe give you one. And the third thing you pay for is for the people who use the service and don't really need it. And you can't scoff at these people. It is not their fault. It's because there is no break whatsoever to a totally available service. They use it. I was recently in a dime store, and over the loudspeaker system they announced that they were giving free ballpoint pens away at the stationery counter. And the whole store almost emptied towards this counter, where they all grabbed their little ballpoint pens, which weren't worth 10 cents. Most of the people didn't need one. They'd possibly got 50 of them at home, but it was free, so they went for it. And it's just somehow in human nature that if there is something available, you wake up at 10 o'clock, or you're awake at 10 o'clock in the evening, and you have a headache. It may be the hangover from what you had in the afternoon, but you might as well get a professional opinion if it's not going to cost you anything out of your pocket. So you call up the doctor. And it's just human nature, I'm afraid. When Medicaid hit New York State, the system we had before that time in Westchester County worked very well. And I think Ed will agree, we liked it. We had private practice of medicine. Then we did have welfare patients. And every doctor had some on his list, and they came to see you. The county did reimburse for costs, but only costs alone for what you paid. So I think it was $2 for an office call and $3 for a house call, which was certainly hardly covered expenses. Now, all the doctors in the towns and in the country were all on staffs of hospitals. We all did clinics, which we gave our services completely free. I know Ed did an orthopedic clinic at least every month at some hospital, either St. Elizabeth's or St. Joseph's. I did clinics in orthopedics, in surgery, and internal medicine at 3 different hospitals. We also took our turn of 2 or 3 months per year on the wards, that is, for indigent patients coming in. They were assigned to us, and we looked after them in no different manner to what we looked after our private patients. The patient who was in the next bed didn't know that they were a service case. And this way we took care of those who couldn't afford it and needed our attentions badly. Well, Medicaid came, and suddenly I had about 50 patients. Out of a total, I had about 3,500 patients on my records. And my 50 welfare patients, I found out the welfare department under Medicaid was going to pay me more than I normally charge for my office call, $1.50 more actually. But there were all these strings attached, and here was socialized type medicine, and a lot more patients were going to have this little white card with the numbers on it. So I said no. I sent a letter to all the patients saying I'd look after them free for 1 month whilst they found another doctor. So at the end of the month, I was 50 patients less. I suddenly found that those 50 patients had actually taken up over 1/3 of my time out of a total of 3,500 patients. I took on another 500 patients over the next 6 months, and I was still working less than when I had 50 so-called free patients. And then I reviewed, looking back, of why did they come and what happened. And I remember distinctly one little lady who smoked at least 4 packs a day and coughed, and that was her main reason for coming. She coughed so hard she did get a pain in her chest. So I used to see her about twice a month and give her a bottle of cough medicine, and she did pretty well, and gave her the same lecture about stopping smoking, but she never did. Anyway, she went to a new doctor who opened his office upstairs, who took all my Medicaid patients, and his total, he had 50 patients. This little old lady then gets a cardiogram once a month, a chest x-ray at least once a month, sometimes twice a month, a blood test every time she goes, and a urinalysis, and she was in the hospital 4 months out of the year. When they threw her out of one hospital, they moved her into another. And I worked it out that the cost of looking after this little lady's smoker's cough was something about $3,000 for 1 year, which wasn't a bad income for the doctor. And you can say, well, yes, he was practicing good medicine. He gave her all these tests and everything else. But we can't afford that sort of medicine. And I honestly don't think it added to the quality of that lady's life. Though she did enjoy being in the hospital, I must admit. It's the only time. Now, this is a blaring example. And this little old lady doesn't think she's doing anything wrong, and she was encouraged in this. You know, the family said, oh, you're coughing, you must go. Doesn't cost anything. And this has got what you've got to multiply 10 times over when medical care becomes totally available. Let's look at a few other things, what's happening in Britain at the moment. Please let me know when you want to. Of my class, there were 35 of us that qualified. Only 5 are left in Britain and didn't stay to stand the system. As a hospital doctor, I worked extremely hard. I was only newly qualified, but after 4 o'clock in the afternoon, I was in sole charge of 2 36-bed surgical wards. I did all the major surgery that came in during the night. I do emergency gastrectomies, colectomies, perforated duodenal ulcers, and what you wouldn't allow anyone to do here until he's had 5 years senior training afterwards, after his qualification. I thought I did a good job, and I don't think I lost a patient, but when you try and look at it from a patient's point of view, arriving at a hospital, who is going to operate on me? You have no choice whatsoever in a hospital there under socialized medicine. 75% of the doctors working in hospitals at the moment in England are not of English or United Kingdom origin. They're either from India, Pakistan, Egypt, China, a number coming from the Commonwealth, Australia, South Africa, to get experience. But only 25% graduated at English medical schools. I don't think this is a very good thing. Now, are the patients satisfied with it? It's a strange thing that most people in England are vaguely satisfied with it. They still think it doesn't cost them anything, because they haven't known any better since 1948. They did see a new hospital completed last year. It was such a big event that the Queen came to open it. It was in all the national papers, every single newspaper, and the local newspaper, it happened to be in a town where my parents live, it lasted a whole week, every night, nothing but the hospital. It was souvenir issues. And I must admit, it was a great event. Since the health service started in 1948, this is the 3rd hospital to be completed. That is rather a bad record. The first one was Welwyn Garden City, which is a general hospital. The second one was in Manchester, which was really only a wing added on to another hospital, half of which is for dental cases. And this one in Kingston upon Hull is the 3rd. 2 other hospitals have been opened, and these were by local doctors who did it privately, who just were sick of not being able to get a patient into a hospital. So they bought a house and converted it into a little hospital, mainly for maternity cases. But this isn't very good. Most of the hospitals in England were built before 1891, and you can tell when you go in. I'm just thinking about that. That's a long time. It was before I was born, actually. Yeah. So, the costs. I have to make you all stand up again in a minute. Yeah. Oh, sorry. I said I'll have to make you all stand up again in a minute. I'm trying to leave salient features, points with you, and maybe rather than going rambling on about details of the socialized medicine. So maybe I will just talk about waiting lists. As an outpatients officer at the Royal Throat Nose and Ear Hospital, I had to screen people for having their tonsils out, and we only put people on the list who really had severely diseased tonsils that were affecting the middle ear, or they'd had rheumatic fever or something like that. At the time I had the position, my waiting list was 8 years to have the tonsils out. So of course you sent for a kid on the list, and a great big gawky kid of 17 walks in, and he hasn't got any tonsils. They've disappeared in the meantime. So we used to review them every 6 months and alter their priority on the list to see who comes in first. But I think possibly the fastest anyone got their tonsils out was a year to 18 months, and they had to be pretty bad. The time I was in the hospital service, the waiting list for a hernia was 18 months, and for varicose veins, something about 2 years. I think this has improved a little bit, but not that great. Basic premise that went wrong is when some politicians propose a system like this, they grasped these little ideas, and one was that if total available medical care is there for everyone, eventually all diseases will be cured and the costs will just diminish to nothing. I'm afraid they're sicker than ever they were. And this brings us to a point about medicine in this country. I think the optimum amount of medical care has already been reached, if not overreached, for the majority of people. 10% of admissions to hospitals in this country are for iatrogenic disease, that is caused by treatment or the medication that they were taking. And I think this has got to be considered. Somehow there has to be a balance between what is available for necessary things, and there has to be a little break to stop them being used unnecessarily. And that is individual responsibility. So think about a few things. Is it required here? Have we got the same situation that Britain had in 1945 of a great mass of underprivileged who had never known any good medical care? Can we afford the massive burden of the bureaucratic costs and the costs of treating people who don't need any care? I don't think we can. And I think we've got to do all we can to keep the quality of medical care, which is the only way to do it is by the private enterprise system. Okay.